This year, we haven't had cases of measles in our state yet, but they're coming. It's inevitable. "2025 was the worst year we've had for measles across the United States, both in terms of numbers of cases as well as numbers of deaths since 1991. It's actually the most contagious disease that we think about in the infectious disease world. It's so contagious that it can hang around in the air for hours after a person has left a room. So you can actually be exposed to measles by someone who left a room 2 hours before you entered that room. If you're vaccinated, you're good. So when I talk about those who are most vulnerable, with measles in particular, I'm really talking about little ones. So usually kids don't get their first dose of the measles vaccine until they're over 1 year old. So for those little ones who don't have immunity, for babies who are just a few months old, this can be a devastating illness if they're exposed at that very young age. So a lot of people just think of this as a rash. It's not just a rash. It can be accompanied by a very high fever, a fever that can lead to complications like febrile seizures. It's accompanied by other symptoms as well, cough, conjunctivitis, or irritated eyes, and it can lead to a lot of complications. And about 1% or just under 1% develop other complications. And those could be complications like pneumonia. They can be complications like encephalitis or swelling around the brain. That can even lead to long-term neurologic deficits, things like seizures or even hearing loss. And that hearing loss can sometimes be long-term. 2 doses of the MMR vaccine is 97% protective against all forms of measles. In 2017, we were at about 75% of our little ones vaccinated against those routine diseases, not talking about flu or COVID or anything like that, just things like polio and measles. That number has declined from 75% down to 68%. And then if we dive a little bit deeper and look at the school data, we've got schools that have 98, 99% of their students vaccinated, and we've got schools with 40% of their students vaccinated. So if we see a single measles case in one of those low vaccination schools, it could result in a huge outbreak. One of the things that's really frustrating for me as a physician is I know the benefit that vaccines provide to our communities. There are a lot of folks out there who haven't seen a case of measles in real life. I've seen patients with measles and taken care of this. I know how bad it can be. And I've seen other vaccine preventable diseases. And in fact, I have taken care of patients dying from preventable diseases. So it is frustrating for me as a healthcare provider to know that we've got tools and that people aren't using those tools to keep their children safe right now. But I also have to understand that people are coming from a place where there's a lot of questions right now. People have doubts, and we've got to be able to have conversations about vaccines where we're talking about the science and the data behind vaccines and not making this a political conversation, because this is not at all political. This is just purely a medical issue, a scientific issue, and we've got to treat it as such.